KROK test devoted to так, need here, сейчас now I need to check him. Так, need he came to us, yes. Guys, KROK test devoted to bleedings, yes, and then we turn to the KROK devoted to our topic, it is weakness of labor, yes, uterine inertia and enduring in labor. Guys, for tomorrow, I don't give you any task. We will speak about the fresh KROK test. Yes, no, I want to give you 18-year KROK tests. Yes, and we will speak about the specificities of this new KROK. A lot of tests devoted to the diseases of mama, for example. And sometimes you make mistakes in this test. We will speak about it tomorrow. No any task for tomorrow, but you need to be in time. We will begin from KROK of 18th year. Maybe I can short. Tomorrow will be only 2 hours. Yes, not 3 as we have every day. Yes, but 2 hours. But they all devoted to the KROK of the fresh KROK, as I say. Yes, and we will speak about this specificities of this new KROK. Guys, I want to ask you, do you have the KROK of 19th year? I have only photo, but you have, yes? Guys?
Yes,
you have. It's very good. No need to send you. That's why we will speak about this, not KROK devoted to the topics, but all topics are present. That's why we will speak tomorrow about this KROK. From Monday, I don't know exactly, guys, if it will be any department meeting. We need to begin our classes some later, but I will tell you about it. I don't know exactly because our head of department abroad now, and if he return, he make this meeting, yes, and that's why we begin our classes some later, but I don't know exactly when. Maybe I sent the information to your monitor and monitor sent to you. I don't know exactly, maybe at the same time, but I don't know. Now, KROK test, guys, and first is this for Hunya, please read the test.
Prima gravida woman appealed to antenatal clinic on 22nd with complaints of boring pain in the lower part of abdomen. Anamnesis registered that her last menstruation was on 4th of January. Bimanual exam revealed that uterine cervix is intact, external forces is closed, uterus enlarged up to 9th week of pregnancy, movable and painless. What complication can be suspected? It's a risk of abortion in the 9th week of pregnancy because
yes. Why it is not, for example, abortion that started at 9th week? Why it is not hysteromeoma? Can you give me, or vesicular mole? Can you give me your argumentation?
The hysteromeoma is a tumor of the uterus. But this person is obviously pregnant, so it's not a tumor, right? Yes. And the external, so we know it's not abortion that started.
Abortion that started can be or no? Why?
No, because the cervix is intact and external is closed.
Yeah, you are quite right. Risk of abortion. We have delay of menstruation. We have pain in the lower abdomen, and also pregnant woman. Yes, pregnant uterus. Yes, and of course it is. Thank you very much. The next, please. Who is here? Tak, Aulak here. Yes, Navjot.
Yes. A 26-year-old woman had the second labor within the last 2 years with oxytocin application. The child
guys, excuse me, my dear, stop please. Guys, every year this test repeated. And they told you, do you think that it is extraordinary? 2 years with oxytocin application, guys.
Yes.
Second labor and last 2 years with oxytocin application. It means was 2 hours, guys. It is mistaken, KROK. Understand, guys?
Yes, teacher.
Yes.
Yes, they use oxytocin application prolonged 2 hours, but it cannot be 2 years, guys. That's why. Then read,
But
please. Then
the
continue.
child weight is 4,080 gram. After the birth of placenta, there was massive bleeding, sign of hemorrhagic shock. Despite the introduction of contractive agent, good contraction of uterus, and absence of any cervical and vaginal disorder, the bleeding proceeds. Choose the most probable causing of bleeding. Atony of uterus, teacher.
Yes. No, hysterorexis, you maybe know why does it cannot be hysterorexis. Yes, stop
Yes,
of labor
teacher.
activity usually.
Placenta.
Yes. Delay of the part of placenta, no any sign in this test. Injury of the cervix. Guys, I want to pay you attention because to my mind some mistakes present in this test. Yes. Despite the introduction of contractive agents, yes, no, absence. And how you understand absence of vaginal disorders? They vaginal injuries. Internet
Teacher,
connection, they told me that's not so good.
teacher, there is
Guys, vaginal disorders, it's wrong word, guys. Vaginal, they mean there is no other trauma of the birth canal. Vaginal trauma, they mean vaginal injuries, but not disorders. How to understand vaginal disorders? No vaginal disorders, maybe of the menstrual cycle. Disorders maybe of the function of the ovaries. But vagina, it is the vagina. It is organ with a cavity, yes, and the mucosa and muscly. Yes, and that's why vaginal trauma, vaginal and cervical trauma or injuries. And of course, it is atony or uterus. Usually, what characterizes atony? Any treatment failure. Contractive drugs cannot help us. Yes, continuous bleeding, and that's why, of course, and pay attention. What is the reason of this atony to your mind? Can you tell me, my dear? See,
teacher, there is
what they gives you?
teacher, there is a hemorrhage, and there is no
Hemorrhage maybe
contraction.
yes, and no contractions. It is atony, of course, and atony the cause as soon as possible. It is large fetus due to the overdistension of the uterine muscles. You see, macrosomic fetus, very large weight. Yes, overdistension of the uterus can cause atony. Thank you. The next, please, Kaushal, absent or present? Because I don't.
Present, teacher.
Good. Read please the test.
Immediately after delivery, a woman had hemorrhage. Blood loss exceeded postpartum hemorrhage rate and was progressing. There were no symptoms of placenta detachment. What tactics should be chosen? Manual removal of placenta and afterbirth.
Of course, yes. There is no signs of detachment of placenta. We need to do it with the help of our hand. Yes, that's right. Tamponade, usually we use if placenta was separated and atony bleeding. Now all this method is not revision. It is 2 hours after. KROK method now we don't use. I told you about this method, pushing of the placenta with the help of the pressing of the uterus, yes, and intravenous injection of methyl and gametrin with glucose cannot give us any effect because labor, it is usually if placenta was separated. If placenta inside the uterus, only it is manual removal. Thank you. The next, please. Khan, present? Yes, present. Read please the test. Khan.
34, a woman is 34-year-old. It is her 10th labor of full term. It is known for the anamnesis that the labor started 11 hours ago. Labor was active, painful. Contraction started after discharge of water become continuous. Suddenly the percussion got knife-like pain in the lower abdomen and lower activity stopped. Examination revealed positive symptoms of peritoneum irritation. Ill-defined uterus outline, fetus was easily palpable, movable, fetal heartbeat was not auscultated. Rupture of uterus.
Rupture. What are the main symptoms of this rupture in the test?
The water become uterus outlines of the uterus, and also long labor, like labor is more than 11
It's
hours.
maybe.
Yeah, and
Guys, it's maybe if it is weakness of labor. I told you every time, knife-like pain, yes, and labor activity stopped. It was labor activity, but suddenly stopped. Knife-like, suddenly rupture of the uterus. Knife-like pain, stop of labor activity. Yes, fetus easily palpable and movable above the anterior abdomen wall. Remember, guys, please, every time I
the
face
fetus is
you. Yes. The next, Singh, please, Mandeep Singh, please read.
Examination of placenta reveals a defect. An operation performed manual investigation of uterine cavity, uterine massage, prophylaxis of pancreatitis in the postpartum period should involve following action: antibacterial therapy.
Yes, of course. If you speak about the endometritis, can you explain me what does it mean endometritis?
This one is the inflammation of the inner lining of the uterus.
Yes, if it is inflammation, antibiotic therapy. Yes, yes. Thank you very much. And remember about it, please. If it is defect of placenta, yes, we perform removal with the help of the manual removal. You see here manual investigation of the uterine cavity. Yes, uterine message in the case when we have bleeding. Yes, no, and of course it is endometritis, inflammation, antibiotics. It is keywords for this. Yes, all word with finished with T's is yes, it is inflammation. The next number 16, it is Ashit. Yeah, Mahanti. Read, please. Yes, but what are the signs of this shock? Lumbar pain, fever, yes, yes. Adenomia, then acrocyanosis and profuse and increase of the temperature. That's why during hemotransfusion we make the measuring of the temperature every hour. Yes, during transfusion, it is very slowly happens. Yes, and if we have slightly increase of the temperature, we stop this. It is one of the first sign of something wrong in this chemotransfusion unit, and it is chemotransfusion shock. Thank you. Так, then euthymia, please. Oh, excuse, так, no. It is should be ashit, yeah? No. Umachantia answer me. Euthymia now, yeah? Guys, who need to be the next? Mahanti, yes? Thank you very much. Euthymia, please. Euthymia. Natalia, where is you? Euthymia disappear. Так, now I put you. Guys, who так? Euthymia absent. Так, please. Need please read the test.
Primary gravida in her 20th week of gestation
Need
complains.
he also?
Ma'am, I'm here. I'm reading.
Yes, I see, my dear.
Okay. Primary gravida in her 20th week of gestation complains about pain in her lower abdomen, blood smears from the genital tracts. The uterus has an increased tonus. The patient feels the fetus movements. Bimanual examination revealed that the uterus sizes corresponded to the term of gestation. The uterine cervix was contracted down to 0.5 centimeter. The external orifice was open by 2 centimeter. The discharges were bloody and smeary. What is the most likely diagnosis? Okay, it's incipient abortion because the uterus size corresponds to the term of gestation.
Yeah.
So, and the external orifice is open by 2 centimeter, and there are bloody and smear. The discharges are bloody and smeary. It's not heavy.
But
Heavy. It's not profuse bleeding, but it's just a bloody and smeary discharge. So,
my dear, sometimes you need to mix with abortion in progress. Very provoke test this. I
if
don't
it is
like
abortion
test.
and
But
progress, then it would be profuse bleeding, right? Isn't it?
profuse bleeding and he cannot feel the movement of the abortion. But
Yes.
Patient feel the movement of the feature alive. Yes.
Yes.
Abortion in progress, feature dead. Yes. That's why remember this.
Ma'am, how to differentiate between abortion in progress and incomplete abortion? Ma'am, we can't hear you because your internet connection has some problem. Ma'am, your internet is too bad.
I told you.
Ma'am, your internet is like pathetic.
All three